Hi everyone, I want to talk about heart failure prevention. But before you can enjoy this, it would be nice if you can watch my other presentations on heart failure before now. Okay, let's go. Prevention. You can prevent only what is preventable. Why that? The non-modifiable risk factors that will probably lead to hypertension or myocardial infarction that may eventually lead to heart failure are not preventable. Okay, for example, we're talking of age, you can't do anything with that. Your gender, you can't alter it. Your race, fortunately you are like that, or fortunately you are. Of course, genetics or positive family history is unchangeable. So you can alter the non-modifiable risk factors, and because you can't do anything about it, just take it that there's a faith. Okay, but the modifiable risk factors, those are the ones concerned here. Okay, let's go. First of all, the most important thing is early detection. And early detection will be joint efforts of both the affected individual and the healthcare provider. If the affected individual presents early on time, since he or she has been having signs and symptoms, like if you go through my presentation on signs and symptoms, you understand everything about that. So please, I'm not going to waste time to go over that right now. You can just check my presentation on heart failure, signs and symptoms. Okay, then we have to tackle each of the risk factors one by one, the modifiable risk factors. Number one, hypertension. Hypertension is a chronic disease, but it could be brought under control if you adhere strictly to lifestyle modification and medication by your doctor. Obesity or increased lipid, you shed weight, you reduce junk foods, more exercise, go with your dietitian's pieces of advice, and so on. Myocardial infarction or coronary artery syndrome. Treat appropriately, work against what are the risk factors in your life, take your medications, the same with diabetes mellitus. In the olden days, the teaching in medical school, many years before some of us were even given birth to OAs, once you have diabetes, it's not likely you get out of it again. No. Many people will have diabetes mellitus and actually die of other causes or die natural death if they are complying with the medications and they are guarding against a dangerous lifestyle that wasn't the situation for them. And if they present on time before the disease has taken deeper root in them. Okay? Sedentary lifestyle could easily be changed. You know what I'm talking about? Walk your dog, go and play, run around. Diet, particularly salt consumption, should be decreased. Smoking, I'm going to make a separate presentation on smoking cessation. There's a presentation on vaping on my channel. Please check that out right now. Alcohol, I will not go into details. I have that already produced. Check it out on my channel. Street drugs, check it out as well. Red meat, okay, reduce that. Junk foods, choose veggies, better than junk foods. Structural heart defects, yes, if with the aid of echo, structural heart defects could be picked, then the next thing is to refer appropriately for possible surgical repairs. For example, if there's aortic stenosis, that could be replaced. Okay, the valve could be replaced. When there's left ventricular dysfunction, with the aid of echo and the left ventricular ejection fraction value is known. If it is dangerous, less than 40 or less than 35%, and that determination is made, then implantable cardioverter defibrillator can be placed. And with that, that will prevent ventricular fibrillation, from killing the affected individual. And if this is as a result of cardiotoxic drugs like doxorubicin and tetracycline groups, then just stop the medication. If it is anthracyclines, the oncologist will be contacted, and another type of medication that will help attack the specific cancer could be given without using anthracyclines. If this is as a result of arrhythmias, we're going to treat appropriately, and that is why when there's associated atrial fibrillation and heart failure, we go for digoxin, we go for warfarin, and some people will even give amiodarone. Okay, if a lifestyle will help with the arrhythmia, why not? You take the appropriate medication, and that could even be treated with electrophysiological ablation where it is appropriate. With that, I've come to the end of possible preventive measures that could save lives as far as heart failure is concerned. And the next presentation will be on heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Kindly subscribe to my channel so that you can get these presentations immediately they are published. Thank you.